Hello, and welcome to our first webinar of 2025. My name is Jen Jacoby, and I'm the Director for the Institute of Healthy Living and Chronic Disease Prevention, and it is my pleasure to welcome you today. Before we begin, I would like to respectfully acknowledge that UBC Okanagan is situated on the traditional, ancestral, and unceded territory of the Silks Okanagan Nation. I would also like to acknowledge that many of you might be joining us today from different places, near and far, and acknowledge those traditional owners and caretakers of those lands. Before we begin with our speaker today, we have some organizational points for our webinar. The closed captioning. If you don't want to see the closed captioning, to turn it off, select the hide caption button on the menu bar, and then you can move the box to anywhere on the screen. If you have questions, please type your questions or comments for the speaker, Carla, into the chat box during the presentation, and then at the end of the presentation, I'll be glad to read the questions. Feedback for this event, please afterwards complete our survey. It not only enlightens us about today's presentation, but also enables us to provide future presentations to meet your needs and your likings. So once again, today's event is brought to you by the Institute for Healthy Living and Chronic Disease Prevention at UBC Okanagan. And today's presentation is entitled Child and Youth Healthy Futures, a Community-Engaged Health Equity Lab. Now, Dr. Carla Hilario is going to give us our presentation today, and it is my pleasure to introduce her and turn over the webinar to her. Thank you, Carla.
Thank you, Jen, for the welcome and for opening today's webinar. My name is Carla Hilario. I'm an assistant professor at the University of British Columbia, Okanagan, in the School of Nursing and in the Faculty of Health and Social Development. And today I'll be spending the next 40 minutes or so sharing about the projects that we are currently working on in the Child and Youth Healthy Futures Lab at UBC Okanagan. Thank you, Jen, for the acknowledging the lands where you and I are both joining from, and folks might be joining from other lands across across Canada and beyond. I'm joining from Silks Okanagan Nation territory, and I also want to acknowledge other territories where I have lived and also where the particular work that I'm sharing has been conducted. And this includes the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh peoples and Coast Salish territories, Treaty 6 territories, specifically in the Musqueam, Muskegon, and as well as territories where I've done some training, Wollongong territory in Australia. I also want to take a moment to position myself as an immigrant and a settler on Turtle Island. I was born in the Philippines, in Pampanga, in the shadow of the Ifugao people, and my parents immigrated to Canada in the 80s. I reunited with them at 5 years old, and I was raised in the Lower Mainland of British Columbia. I'm a parent of 2 young children. I use pronouns she, her, hers, or ya or sha, which are the pronouns we use in Tagalog and Kapampangan, and they are not gendered, so they translate to they. Today, I'm reflecting on what that means as being an immigrant and a settler, and also what Indigenous immigrant relations and solidarity building writ large unfold both in the territory where I'm joining from, the lands I'm joining from, and beyond. Again, I'm joining you on behalf of a very active and growing team we have at UBCO in the Child and Youth Healthy Futures Lab, and these are some of the folks that I get to work with on a daily basis. We're working on these suite of projects, all with a community engaged, youth engaged component, and all with a purpose to enhance youth health. So I just want to recognize these folks, Misha Taylor, Pavin Nahal, Stacy Smith, Moha Chaurvedi, and Yasin Yunus, Jacqueline Pratt, Maya Bodenman, um, um, uh, um, and Emily Raboka, and Olivia Stevenson here. And so these are research trainees and staff in this lab. For today, I'll provide a broad overview of some of the work that we're doing, but I'll provide also some specific findings from a couple of projects. I'm supported by a Michael Smith Scholar Award. Yes, Jen, do I need to speak more loudly?
Yes, please.
Yes.
If you could lean in closer to your camera, that would be wonderful.
I have a naturally soft voice. So actually what I'm going to do is I'm going to use my earphones that I've gotten ready for this exact purpose. Is that a lot better?
Wow.
Yes.
Wonderful. Absolutely perfect.
Wonderful.
Thank you.
Hopefully that helps with the recording too. So I'm going to provide a broad overview of the various projects that we're working on, and also present some findings from a couple of projects. Some of the projects that I'll be presenting are part of a scholar award that I hold from the Michael Smith Health Research Foundation. This program of work is looking at addressing the structural and social determinants of young people's health. There are 5 specific projects which fall under that, and some of these projects you'll see also here listed as some of the active projects that I'm currently leading or co-leading. And so you'll see here that some of the projects are looking at development grants and projects looking at identifying mental health needs and specific communities, specifically the Filipino community, which I am part of. So that's in collaboration with partner organizations that serve Filipino populations in BC, projects looking at identifying health equity priorities from the perspectives of youth, trends in racism and mental health, which I'll speak more about, and several projects, as you can see here, that have tried to understand the impacts of the COVID-19 pandemic on mental health. I'll also share about that, and related projects on youth suicide prevention, and looking at how Indigenous and newcomer youth can work towards reconciliation futures. And so in the interest of time, I'll be sharing findings from 3 broad areas. And the first I'll start with is one project that we've explored in different ways here, broadly on youth perspectives on mental health. And so this is a project that was started in 2021. It is in Alberta. We used a youth engaged approach with 4 youth research collaborators who were part of the group that we were aiming to speak with. We used a social determinants of health framework and an approach called interpretive description, which is a type of qualitative research methodology, and did the interviews online because at that time that was what was possible. So these interviews were done in 2022 with 33 young people ages 14 to 19. Some of what we found generally is that mental health worsened for most youth during the initial lockdown. And at this time when we did the interviews, the public health measures in Alberta were just being lifted. So this is in 2022. So that's the context of this particular set of findings, and which have been published here in Global Qualitative Nursing Research. And so some of the excerpts from this article and from these interviews that we conducted broadly highlighted how
the pandemic at the beginning, in the middle, and afterwards, in terms of the measures being lifted, affected the youth and their mental health in unique ways. So here, in the words of Amy, they say, oh, I couldn't swim out with my friends, no school, no sports, no being outside. So it was a lot to go in one piece. At the beginning, when the pandemic started, in the words of Stacy here, everything turned upside down. Freedom I had before the pandemic was no longer there. Social relationships were not there. Physical well-being too was unstable. And so I would say that when the pandemic started, everything just turned opposite in a negative way. And so here these are excerpts from two participants who talked about the negative effects of the pandemic and the related circumstances, the conditions it created for young people in Alberta. And at the same time, there were also some people, some adolescents who actually shared that they were doing okay, and they were doing well at the time, and they actually enjoyed the absence of social demands. They had time for self-reflection, and that their anxiety actually decreased in some ways because they didn't have to go to public spaces. So there was a diversity of experiences, and that's captured in the overall article. But by and large, for many of the youth, what was striking and what we hear as well from what we've heard in other work is that there was a general worsening in terms of really feeling isolation. And that isolation was captured quite vividly in the words here of Chelsea, who says, I slowly became grayer and grayer. If you were to put it in the way of a metaphor, before I was very much like a rainbow, and then I slowly became duller and duller and duller. And so they really spoke about how, as the pandemic progressed, this affected their daily lives in a profound way. Again, because these interviews were done in 2022, we also heard from youth just at that time what it was like kind of after the pandemic. And so here, in the words of Eric, a lot of things changed because now we're all glued to our phones. I think the pandemic might have caused that. Ava talked about the level of isolation that went on for that long. Even when we were allowed to be connected again, those walls had already been built. And these were the words we used as well in the title of this article. As Ava says, we were still in the process of taking them down. So it wasn't this quick and easy shift back into how things are supposed to be. So I felt like there was going to be some leftover isolation. And Ava continues there to talk about for them specifically, they just needed, they would need some more time, and that is different for other people. As part of this project, you'll see here in this approach, we also use a social determinants of health framework to try to understand how we could use this framework, drawing on youth perspectives to identify social determinants that we know affect health and mental health that were particularly salient during the COVID-19 pandemic. So we looked at our interview data and looked at what youth were talking about, drawing on what we know, the known social determinants of mental health. And the ones that really came up and that we highlight here are the determinants of education, access to health services, employment and income security, and social support. Education, some youth described this as the one that hit the hardest, the one that really affected them. And for some youth, as you can see here, it really affected them in such a way that it affected their academic performance, their achievements, their grades. And for some participants, they loved online schooling at the time, and it was a welcome transition. So again, a diversity in experiences, although by and large, what we heard was that online schooling was a very difficult transition. And as Ava says, the hardest thing for some youth to adjust to. Another determinant that we saw really highlighted in the interviews was access to health services, and especially the beginning of the pandemic when everything was shut down. So at that time, there weren't the resources to help you, in the words of Amanda, because everything was shut down. And even if you did access, it'd be so long to wait to talk to someone. And things were always virtual, which I don't necessarily love. And at the time I hated it. And so the shift to service delivery, to online, was in general, in this study anyways, it was generally not preferred. Employment and income were another determinant that came up. And having to cope with basic needs. So in the words of Mary, now that my mom is at home, we don't have really enough resources to stay online. So their internet was affected. Sometimes when I miss my classes, I'll feel sad because I'm trying to learn on my own. I don't really understand. And not having people to ask questions. And so ways that people's financial situations, employment situations affected, in this case, a young person's ability to engage with school. And added to this, some youth also spoke about parents having to switch jobs or having to go away, and how that affected their family and how that affected them. Social support, this was a really, really key social determinant that was highlighted by the young people we spoke to. As Ava said, I started not to enjoy talking to people before COVID hit. I really loved talking to people. And it just became harder to even consider planning socially distance meetups. And it just wasn't worth going out there. I just lost my social connection, and not having that really hurt my mental health. And so there was really an awareness of those losses, and the lost connections, the changes to their peer relationships. And there was, as you can see here in the words of Ava, reflection on how that affected their mental health and well-being. Now, conversely, in terms of social support, although young people cited not being able to go to school and not being able to interact with their peers as something that negatively affected their mental health, some of them also recognized how spending more time with their family was something that was really positive for their mental health, and improving their family bonds and being there for each other, being there for their family members. So having a mother sick and needed to be there for each other, strong for each other, and that bringing them closer and improving those relationships, and that having a positive effect on their mental health. Now, related to the work of speaking with youth directly, we've also done some work actually looking at the healthcare use of young people. Again, this is work done in Alberta. And some of this work here has been published, and I'm happy to share these references later on, or the articles. And so in this project, we looked specifically at patterns of health service use by youth for mental health reasons before and during the COVID-19 pandemic. We looked at changes in mortality, so deaths during the pandemic, and also if specific subgroups had different patterns of use among the youth. For this work, is a very different approach. We used a population-based cross-sectional study. We used provincial healthcare administrative data, so from Alberta Ministry of Health, as well as related data on deaths from the government of Alberta and census data from Statistics Canada. Our study population, in defining it for this project, were youth who were 15 to 24 years old. And we used the fiscal year periods between 2018, 2019, which we classified as pre-pandemic, to 2021, 2022 during the pandemic. And we, at the time when we were starting this work, that was all of the data that was available, because there's usually about a year delay in the data being ready. All analysis was done using SAS, and this is a project that was funded through the Canadian Institutes of Health Research, STAGR. Some of the overall findings from this project, and the article provides a lot more specific findings, including the graphs of the trends that we saw for specific diagnoses, but overall, the findings show that there was a significant increase in the proportion of youth using mental health care, with the largest increase during the pandemic, so between 2020 and 2021. There was an initial drop because services were not available, and then we saw a steady increase as the general pattern. Over time, we also saw that youth that used mental health care were on average younger. So we saw younger youth in those visits, more likely to be girls, young women, less likely to be from rural settings, more likely to be living in a higher socioeconomic status neighborhood. So we had data on neighborhood SES status, and less likely to be on income support. So some of the salient or some of the notable shifts that we saw was that there was a higher proportion of girls, women, than boys, men in use of health services for mental health. And there was also less use for poorer youth. And because this is administrative data, we are supplementing this as well with some other methods to try to understand this a little bit more. Another thrust of work within the Child and Youth Healthy Futures Lab is trying to understand as a key social determinant of health, the effects of racial discrimination, and specifically related to racism and mental health. And so we have a couple of ongoing projects with this, using different data sets. One data set that I'm currently using is the BC Adolescent Health Survey data, which is a population-based data set across British Columbia in various school districts across the province. This project is supported by a Racial Justice Award from the Society for Adolescent Health and Medicine, and it's in collaboration with McCreary Center Society as well as Theravic at UBC Vancouver. In this work, and some of which has been published, so we've done an analysis of trends in reported racism and mental health outcomes in a 15-year period, so 2003 to 2018. And in that work, we saw that consistently, as hypothesized, experiences of racism were associated with poor mental health in general, higher rates of stress, despair, suicidal thoughts, suicide attempts, and not receiving needed mental health services. So foregoing care that young people felt they needed for mental health. And there were significant gaps in outcomes based on experiences of racism. So we saw that those who reported racism versus those who did not report racism differed significantly in terms of their mental health outcomes. And importantly, there's been no change in these gaps in the past 15 years for these variety of mental health outcomes. We also see that unmet mental health care needs seem to be increasing. We are continuing this work using the latest cycle of the BC Adolescent Health Survey from 2023. And so we're actually just completing an updated analysis of these trends, looking at the last 20 years, and also looking at differences and gaps in the mental health of those who are immigrant and Canadian-born Asian adolescents, as well as looking at these trends by gender. So doing a gender stratified analysis. Okay, and the last bit of work that I'll talk about today is some work that was used to inform a recent report by the Public Health Agency of Canada on inequalities in mental health, well-being, and wellness. It was released just a couple of months ago. And I served on their steering committee in developing this project and in the reporting. So alongside many folks across Canada who have been engaged in mental health research or mental health policy work. And so as part of this committee, we met several times with the PHAC team, including an in-person meeting to discuss some of the preliminary findings and implications, which are now released in this report. This project is a Public Health Agency of Canada initiative. It is aimed at understanding the role of the social determinants of mental health in Canada, describing the magnitude of and changes in mental health and social inequities over time and among different subpopulations, and informing action to address modifiable factors influencing differences in mental health experienced by different population groups. And so it was a very informative experience for me to be invited on the steering committee because it directly aligns with my own work and with my research and provides synergies in terms of understanding what is known, the landscape of evidence, and implications moving forward. So in developing this PHAC project, the committee decided to take the approach to look at the qualitative research available first, using available literature, to drive then the quantitative analysis of available data sets across Canada. So they started from a point of mapping and coding qualitative studies to identify key themes, and then the quantitative analysis followed from that. And so some of these key themes looked at socioeconomic conditions and how those affected mental health and mental health care access, discrimination, specifically racism, xenophobia, homophobia, and how that affected mental health of particular groups. Social and cultural connections, the importance of support networks and community belonging, and lastly, access to quality of and use of healthcare services. So the available evidence on use of services for mental health. those themes drove the quantitative analysis of data sets that showed high self-rated mental health declining over time for racialized immigrants, as well as for racialized immigrants and as well as for racialized non-immigrants, particularly during COVID-19. The findings also suggest unmet needs for mental health services that are consistently higher for racialized folks, higher unmet needs for people identifying as females, women versus males, immigrant versus non-immigrant, and those who identify as gay, lesbian, bisexual versus heterosexual. And so moving forward from the work of this project, some of the considerations that have stemmed from this are to, and also some of, I would say as well, the key implications of the approach that was taken is to really broaden understandings of mental health, well-being, and wellness, to fully understand people's lived experiences, looking at ways to integrate equity as a priority in mental health care, partnership across sectors. So use of intersectoral partnerships, including quality of life and well-being frameworks and health in all policies. And these are policies that are being taken up more and more in other in other jurisdictions in other countries, contexts like Europe. Employing universal policies alongside targeted interventions for particular groups to address those inequities and differences, and filling data gaps through expansion of data collection on social determinants of health, and also ensuring ongoing equity monitoring. And so these are some examples that the lab has been working on with this most recent example, this project. Sorry, excuse me. This most recent project, really quite a critical piece of work to inform practice, policy, and research in the mental health field, broadly speaking. So it is a really valuable document to guide the work of folks wanting to do work or are doing work in this field.
Take your time, Carla. It's totally okay. It's a long time to talk.
Actually, the timing is perfect because I'm going to end on that note. And thank you all for being here listening to the findings that I selected to share with you today. And I'm really excited to look forward to the discussion and hearing your questions and speaking more to either the projects that I spoke about today or some of our other work.
Thank you, Carla. Thank you for doing this important work and also for sharing it with us today. I encourage guests to please place your questions in the webinar chat box, and I will be glad to read them out for you. And I'm certain Carla looks forward to addressing them. Carla, I'm curious, get your breath. But I am curious, as we move forward, and a lot of your data was presented from the pandemic standpoint, for parents, educators, researchers, care providers, is there a specific or unique lens that each one of those groups need to approach mental health with youth, or is it more of an interdisciplinary and collective approach? Could you give some guidance, especially for those that wear the hat potentially of parent, as well as maybe professional? How do we blend the differences, or do we need to?
Thank you, Jen. That's a great question. And to speak to providers, those who are providing care to this particular group, and specifically mental health care, as part of the COVID and Youth Mental Health Care Youth Project, I'm actually in the process. I'm in the midst of interviews with healthcare providers who provided care during the pandemic. And so that is upcoming work that we look forward to sharing. I mean, yes, I've just completed some interviews yesterday, and it will definitely be helpful to hear about the provider experiences in terms of what they've observed, reflecting back on the last 5 years. And so thinking about pre-pandemic, during, and then what have we learned, and what do we still need to learn, and folks still wondering as well, even though it's been a couple years, what did other providers experience? What did they observe? What changes did they see? And so we're really looking forward to working and being able to share out that data. In terms of parents, in our work, we focused on youth perspectives and invited parents as well. Now we really only heard from young people, but as a parent myself, I more and more I'm interested in hearing from parent perspectives as well on what was it like supporting care, knowing how interconnected, and the providers share that too. And even the youth have an awareness of how interconnected and how important it is to look at mental health as a family, or whatever that family looks like for young people, and how interconnected, especially parent-child mental health can be. So it would be great future work, and to look at how those perspectives can inform each other. In terms of your question around interdisciplinary collaborative work, absolutely. So we're hearing from providers from a variety of different disciplines, from outpatient acute settings. And maybe I ought to contextualize that this work was in Alberta because prior to joining UBCO Okanagan, I was at the university. I was faculty at the University of Alberta in the Faculty of Nursing. And so these were all projects that I was wrapping up when I joined UBCO about 2 years ago. I hope that answers your question, Jen.
No, absolutely. Thank you for sharing that. I'm going to read the next question in the chat box from Michelle Anderson, who asks, were there any surprises to you or unexpected findings in your findings?
So I'm going to go to, there were, just looking for the slide here on healthcare use. Here we go. Yeah, so in this project, one of the surprising, so I didn't share it actually in this, just to keep my presentation brief. But in this project, we looked at 5 primary diagnoses and 2 secondary diagnoses. And one of the 5 main diagnoses we decided on as a research team, and we're a research team of a psychiatrist, a nurse, social scientist. Alberta Health was part of this project. And so we decided on these 7 diagnoses based on what we see clinically, but also in research. And one of these 5, one of these diagnoses was substance use. And so for all other ones, so all the other ones are, anxiety, mood disorders, the most kind of prevalent mental health conditions we see, especially in youth. We saw that the trends of service use were increasing during this period, overall trend. But for substance use, we saw it actually decrease. So service use for substance use decrease in this time period, which really surprised our team. We didn't expect that it would be different for that particular group. And we're still exploring why that might have been the case.
That's interesting. It raises so many questions about accessibility from both a positive as well as a disadvantaged, but also advantaged lens when it comes to many elements of substance abuse. So I'm curious, and I'll look forward to seeing those results and
Yes.
see what you find. Starla has a question for you. Oh, did you want to comment?
Yeah, I just wanted to add one other thing that we know during COVID that substance use actually increased for adults. Like there's available data that shows there was an increase. Now, again, right, this is administrative data. This is telling us how services were used, right? And it's telling us what reasons were youth coming in from, like how are they being coded? And so this tells us about care that youth received for these particular conditions, but it's limited in terms of what youth are actually experiencing.
Yeah, the element of doing versus care seeking is unique. That's a very good point. Thank you for reminding us of that. Now, Starla has a question for you. It reads quite near and dear to her heart, I believe, from her last sentence, but I'll begin by reading from the top. The question is, I feel as though this is quite a broad study. I feel there's a lot more going on, such as online bullying, no matter the race, gender, or sexual orientation. I'm curious as to why only very select few topics were chosen. As a mom of teens, they're in a virtual world and online world. They need to compete with other friends and their likes, the comments, etc. Many teens can be very mean online to all teens, not just the race, gender, and sexuality. I have so many thoughts and comments, but this is a huge one for me.
Well, first of all, thank you for sharing that comment. And I agree that that forms of violence in different ways, including in online environments and harassment, can really affect youth mental health and well-being. In terms of why we selected particular groups or focus on particular aspects, this was primarily driven by for some of the projects, we worked with youth advisory groups, or sometimes it was just a particular foci that was identified. And again, these were some examples of some projects that we've done. And it's not to say that there might be that these are issues that don't affect all youth. And so it would be great to continue to do this work and to look at different groups of youth in different areas, different geographic regions, and looking at the unique experiences of youth who are living in particular social conditions, while also noting, if particular groups maybe particular groups who are living in more rural areas or don't have as much access to supports, or maybe there are some unique factors about their social environment that we can take account, going back to looking at interventions that are universal, let's say for all youth, and then looking at some targeted interventions for those whose needs might not be as well served by those universal interventions. Definitely hearing from parents and family experiences as another window into young people's lives is a next step that I hope to be able to be part of.
I like the way you put that, a window into young people's lives. I'm curious with respect to that comment then, the age range that you looked at, do we need to consider that, coming at from the lens of a university professor, and we've seen such a change in the classroom here, and then through colleagues that are teachers, they're also seeing a change, but it seems to be a little bit different based upon age that was living during COVID and experiencing COVID. Are there considerations that we need to place on mental health that relates to COVID based upon the age of the child?
Jen, yes, absolutely. So considerations in terms of what might be affecting their mental health might look very different. Given these age, this is quite a wide age range. So we're basically looking at older adolescents for some of these projects anyways. There's some projects that are primarily like in that adolescent range, high school aged young people, and then some that are kind of more older adults. And so you can imagine that life circumstances are going to be very different in terms of what might be affecting their mental health. And then in terms of service use, the other reason why we chose this range is that it tells us about it tells us about the youth who are able to access services in those in kind of the more pediatric to adolescent settings, where usually the cutoff age is about 18, 19, and then they begin to transition into adult services. So we also wanted to capture what those transitions were like, and also what it was like to access different types of services. So to go back to your question in terms of their age range, so one, developmentally, quite a different group in terms of what's affecting their mental health, but also how they might prefer and how they might have the capacity to engage in services for mental health. And this is really also becoming really salient in the interviews I'm doing with providers who are seeing youth at different ages and within this age range. And for example, being able to do counseling and being able to do treatment online or on Zoom, different capacity of different youth, and then also different kind of treatment effectiveness that they're seeing just in their experience. And so definitely different considerations in this age range. I hope that answers your question, Jen.
No, it does. And thank you very much for that. I'm just going to let you grab a drink of water there. Now, as we approach the end of today's session, I just want to thank you very much for sharing your comments, sharing your research, sharing your data and your thoughts. Youth mental health is complex. And I think youth, especially for everyone on this call, is near and dear to their heart. So thank you for the work that you're doing. It's greatly appreciated and valued. With respect to today's presentation, I just want to let our webinar guests know that we will be following up with a survey, both about today's presentation with information we can share back to Carla, as well as Institute activities going forward. I would like to remind everyone that March is approaching. I still know it's January and it's a little chilly out there, but March is on the horizon. And for the Institute of Healthy Living and Chronic Disease Prevention, that brings the opposite end of the spectrum, which is Embrace Aging. So I encourage everybody to check out the calendar that's now available online for Embrace Aging Month. That being said, thank you very much, and I wish everyone a splendid day. Take care.